Hi, I'm Jerry Heindel, and I focus on how endocrine disrupting chemicals disrupt your health. Today we're going to talk about the difference between exposure to environmental chemicals during development in utero in the first few years of life and exposure in adulthood. So, exposure during development results in a tissue that looks normal, but at the molecular and cellular level, there are different genes turned on and off, different receptors turned on and off, and different pathways in specific tissues at specific times. And then when the cell and tissue is fully differentiated, those changes are permanent. And so for the rest of your life, you'll have some altered pathways in specific tissues that result in increased susceptibility to diseases later in life. Now, if you have exposure to endocrine disrupting chemicals later in life, once the tissues are all formed, perhaps from years 3 or 4 onward through adulthood, then those exposures will have effects. They will affect receptors and pathways, but those receptors and pathways are already there, and they're just increased or decreased due to the endocrine disrupting chemical. But those changes due to the endocrine disrupting chemical will result in increased susceptibility to different diseases in different tissues. The good news is that these exposures in adulthood are reversible. So if you remove the toxicant, the effect will go away. And that was shown very nicely in the Netflix documentary, The Plastic Detox, where these couples were infertile due to decreased sperm, and they reduced their level of toxicant exposures to BPA and phthalates, and that resulted in a return of the sperm concentration towards normal, and 4 of the 6 getting pregnant and having babies. So there's a huge difference. Developmental exposure is permanent, and there's nothing you can do about it. The rest of your life you'll be susceptible to those diseases, but exposures in adulthood are reversible, and we know how to reduce chemicals to reverse those effects. So that's a good thing. If you want to learn more about endocrine disruptors and how they disrupt your health, click follow.